Top 25 pharmacist interview questions and answers. Pharmacists play a vital role in the healthcare system by ensuring the safe, effective, and ethical use of medications. Their responsibilities extend beyond dispensing medicines to include patient counseling, clinical decision-making, collaboration with healthcare teams, and maintaining regulatory compliance. Interviewers look for candidates with strong pharmaceutical knowledge, attention to detail, communication skills, and professionalism. Preparing consistent, well-structured answers helps demonstrate confidence and readiness for real-world pharmacy practice. 1. Why did you choose pharmacy as your career? I chose pharmacy as my career because it allows me to combine scientific knowledge with direct patient care. I am interested in how medications work to treat diseases and improve quality of life. Pharmacy offers opportunities to educate patients, prevent medication errors, and collaborate with healthcare professionals. I am motivated by the responsibility pharmacists have in ensuring medication safety and effectiveness. This profession also provides continuous learning opportunities and allows me to contribute meaningfully to public health and patient well-being. 2. What are the main responsibilities of a pharmacist? The main responsibilities of pharmacists include dispensing medications accurately, reviewing prescriptions for safety, and counseling patients on proper medication use. Pharmacists also monitor drug interactions, manage inventory, and ensure compliance with laws and regulations. They collaborate with physicians and other healthcare professionals to optimize patient therapy. Maintaining accurate records and providing health advice are also important. Overall, pharmacists ensure medications are used safely, effectively, and responsibly to support positive patient outcomes. 3. How do you ensure accuracy when dispensing medications? I ensure accuracy by carefully reviewing prescriptions, verifying patient information, and checking drug names, strengths, and dosages. I follow established protocols and use double-check systems when available. Staying focused and minimizing distractions is important. I also verify potential drug interactions or allergies before dispensing. Accurate labeling and clear patient instructions are essential. Attention to detail and adherence to standard operating procedures help prevent medication errors and ensure patient safety. 4. How do you handle prescription errors? When I identify a prescription error, I immediately stop the dispensing process and verify the issue. I communicate with the prescriber to clarify or correct the prescription before proceeding. Transparency and documentation are important. I view errors as opportunities to improve processes and prevent recurrence. Patient safety is my top priority, so I take prompt action and follow protocols to ensure the correct medication is dispensed accurately and responsibly. 5. How do you counsel patients on medication use? I counsel patients by explaining how and when to take their medications, possible side effects, and what to do if a dose is missed. I use clear, simple language and encourage questions to ensure understanding. I also discuss storage, interactions, and lifestyle considerations. Effective counseling builds trust, improves adherence, and helps patients use medications safely and effectively for better health outcomes. 6. How do you manage drug interactions? I manage drug interactions by reviewing patient medication profiles and using drug interaction databases. I assess the severity of interactions and take appropriate action, such as consulting prescriber or advising the patient. Educating patients about potential risks is also important. Careful monitoring and documentation help prevent adverse effects and ensure safe medication therapy. 7. How do you stay updated with new medications and guidelines? I stay updated by attending continuing education programs, reviewing professional journals, and following regulatory updates. I also participate in training sessions and discussions with colleagues. Staying current ensures I provide evidence-based care and comply with updated standards. Continuous learning is essential in pharmacy due to frequent advancements in medications and treatment guidelines. 8. How do you handle a difficult or angry customer? I handle difficult customers by remaining calm, respectful, and empathetic. I listen to their concerns without interruption and try to understand the issue. Clear communication and problem-solving help de-escalate situations. If needed, I involve a supervisor while maintaining professionalism. Respectful handling ensures customer satisfaction and preserves the pharmacy's reputation. 9. How do you manage workload during busy hours? I manage workload by prioritizing tasks, staying organized, and working efficiently without compromising accuracy. Teamwork and clear communication help distribute responsibilities. I remain focused and adaptable during peak hours. Proper time management ensures prescriptions are filled safely while maintaining quality patient care. 10. How you ensure patient confidentiality. I ensure patient confidentiality by following privacy laws and pharmacy policies. I avoid discussing patient information publicly and secure records properly. Respecting confidentiality builds trust and protects patient rights. Professional discretion is essential in all pharmacy interactions. 11. How do you handle controlled substances? I handle controlled substances with strict adherence to legal regulations and pharmacy protocols. I ensure proper storage, accurate documentation, and secure dispensing at all times. Each transaction is carefully recorded, and inventory is monitored regularly to prevent discrepancies. I remain vigilant about prescription validity and patient identification. Any irregularities are reported immediately according to policy. Responsible handling of controlled substances is essential to prevent misuse, protect public safety, and maintain professional and legal accountability within pharmacy practice. 12. How do you work with other healthcare professionals? I work collaboratively with healthcare professionals by maintaining clear, respectful, and timely communication. I share accurate medication-related information to support clinical decision-making and patient safety. When concerns arise, I consult prescribers to clarify therapy or suggest alternatives. Teamwork is essential for optimizing patient outcomes. Mutual respect and professional collaboration help ensure coordinated care, reduce medication errors, and improve overall healthcare delivery within multidisciplinary environments. 13. How do you handle medication shortages? I handle medication shortages by monitoring inventory closely and identifying shortages early. I research suitable therapeutic alternatives and communicate with prescribers to adjust treatment plans when necessary. Patients are informed clearly and honestly about delays or substitutions. Proper documentation and coordination with suppliers help minimize disruption. Managing shortages responsibly ensures continuity of care while maintaining patient trust, safety, and treatment effectiveness during supply challenges. 14. How do you ensure compliance with pharmacy laws and regulations? I ensure compliance by staying informed about pharmacy laws, regulations, and professional guidelines. I strictly follow standard operating procedures and maintain accurate documentation. Regular audits and self-checks help identify potential issues early. Compliance protects patients, the pharmacy, and my professional license. Ethical practice and legal awareness are essential responsibilities of pharmacists and support safe, trustworthy healthcare services. 15. How do you handle stress in a busy pharmacy environment? I handle stress by staying organized, prioritizing tasks, and maintaining focus under pressure. Effective time management and teamwork help manage heavy workloads. I remain calm and professional to avoid errors and ensure patient safety. Outside of work, I practice self-care to maintain balance. Managing stress effectively allows me to perform consistently, make accurate decisions, and provide quality care even during demanding situations. 16. How do you manage inventory and stock control? I manage inventory by regularly monitoring stock levels, checking expiration dates, and placing timely orders. Proper documentation and rotation of medications help reduce waste and shortages. I follow inventory management systems and coordinate with suppliers efficiently. Effective stock control ensures medication availability, supports smooth pharmacy operations, and maintains patient safety while complying with regulatory requirements. 17. How do you handle ethical dilemmas in pharmacy practice? I handle ethical dilemmas by following professional ethics, legal standards, and patient-centered principles. I prioritize patient safety, confidentiality, and informed consent. When faced with uncertainty, I consult supervisors or professional guidelines. Clear documentation and ethical reasoning support responsible decision-making. Upholding ethical standards builds trust, protects patients, and maintains the integrity of the pharmacy profession. 18. How do you educate patients about medication side effects? I educate patients by clearly explaining potential side effects, their severity, and what actions to take if they occur. I use simple language and encourage questions to ensure understanding. Providing written information when needed reinforces counseling. Proper education improves medication adherence, reduces anxiety, and helps patients recognize when to seek medical attention, ensuring safe and effective treatment outcomes. 19. How do you handle elderly patients with multiple medications? I handle elderly patients with patience, empathy, and careful assessment. I review their medications thoroughly to identify interactions, duplications, or inappropriate therapies. Counseling is adjusted to their understanding level, and clear instructions are provided. Monitoring adherence and safety is essential. Compassionate care and attention to detail help improve outcomes and reduce medication-related risks in elderly patients. 20. How do you ensure accuracy in medication labeling? I ensure accuracy by carefully verifying drug names, dosages, directions, and patient information before labeling. Double-checking labels against prescriptions helps prevent errors. Clear and readable labels are essential for patient understanding. Accurate labeling supports safe medication use, improves adherence, and reduces the risk of misuse or adverse effects. 21. How do you prepare for pharmacy audits? I prepare for audits by maintaining accurate records, following procedures, and ensuring documentation is complete. Regular internal checks help identify gaps early. Transparency and organization support smooth audits. Audits promote accountability, quality improvement, and regulatory compliance. Proper preparation reflects professionalism and commitment to safe pharmacy practice. 22. What qualities make a good pharmacist? A good pharmacist is detail-oriented, ethical, and patient-focused. Strong communication skills, clinical knowledge, and adaptability are essential. Compassion and professionalism help build patient trust. Commitment to continuous learning ensures up-to-date practice. These qualities enable pharmacists to deliver safe, effective, and high-quality healthcare services consistently. 23. How do you address medication non-adherence? I address non-adherence by identifying barriers such as side effects, cost, or misunderstanding. I educate patients about the importance of adherence and offer practical solutions. Open communication encourages trust and cooperation. Supporting adherence improves treatment effectiveness and patient health outcomes. 24. How do you maintain continuing professional development? I maintain professional development by attending continuing education programs, reviewing medical literature, and participating in training sessions. Staying current enhances clinical skills and ensures compliance with evolving guidelines. Continuous learning supports professional growth and improves patient care quality. 25. Where do you see yourself in 5 years as a pharmacist? In 5 years, I see myself as an experienced pharmacist with advanced clinical knowledge and leadership responsibilities. I aim to contribute to patient care excellence, mentor junior staff, and possibly specialize in a clinical area. Continuous growth and dedication to healthcare improvement remain my long-term goals. Pharmacist interviews focus on clinical knowledge, accuracy, ethics, and communication skills. Preparing consistent, detailed answers demonstrates professionalism and readiness for practice. Emphasizing patient safety, teamwork, and continuous learning strengthens your profile. With thorough preparation and confidence, you can present yourself as a competent pharmacist committed to delivering safe, effective, and patient-centered care.